After having ruled out the rhythms at a glance, which are so typical that you should be able to recognize them immediately, we shall now continue the evaluation of rhythm problems in a more systematic way. One feature of a rhythm strip that is a real eye-catcher is when the heart runs in a rapid manner, something that we call tachycardia.
The word tachycardia consists of two different Greek components. The first is tachys, which means fast, and the second one means cardia, which means heart. Tachycardias can come in various different forms. Let's look at some of them. Here are a couple of examples. This is fast too. And what these two tachycardias have in common is the fact that they're rapid and regular. Well, every tachycardia is rapid, right? But not everyone is regular. What do I mean by regular? Regular means that the distance between the QRS complexes is constant. This is the same distance as this one, the same as this one, and the same as this one, and the same holds true for the tachycardia below. This distance is the same as this one, as this one, as this one, and it goes on like that. Now here's a slightly different case. This tachycardia is rapid and irregular. You see that the distance between the QRS complexes varies. So this is different than this one, than this one, than this one, than this one. So really no two distances are the same. We're going to deal with rapid and irregular tachycardias a little later, so let's just forget about them for now. Rapid and regular tachycardias can come in two different forms. One is a broad complex tachycardia and the other one is a narrow complex tachycardia. Let's check it out. So here, the distance from the beginning of the QRS complex to the end of the QRS complex is 0.12 seconds. And as we already know, that's too broad. In the example below, the distance from the beginning to the end of the QRS complex is 0.06 seconds. So this is a narrow complex tachycardia.
Let's check out what causes a QRS complex to be narrow or broad. In order to understand that, we need to review the cardiac conduction system and how impulses are transmitted inside the heart.
Let's recap. This is the AV node, this is the bundle of His, this is the right bundle branch, and this is the left bundle branch with the left anterior fascicle and the left posterior fascicle. When the impulses are generated in the atria and are conducted into the ventricles through the AV node, the bundle of His, and the bundle branches, the ECG will look like this. Ventricular depolarization happens fast, and therefore the QRS complex is narrow. Let's look at a slightly different example. If the impulse takes its origin in the atria, enters the ventricles through the AV node, but finds one of the bundle branches blocked, as in this example, the QRS complex will show a bundle branch block morphology and will therefore be broadened. It will be 0.12 seconds in duration or longer. This example shows a right bundle branch block and what the ECG would look like in B1. If you're still a bit confused why the QRS complex is narrow over here but broad over here, then think about it like that. Imagine someone filling up a pool. In the first instance, he has a friend available with another second hose, so filling up the pool will be much faster. In the second instance, he only has one hose available, so filling up the pool will be much slower. Similarly, depolarization of the ventricles will also be much quicker if you have two conduction pathways, the left and the right bundle branches available. However, if you only have one hose or one bundle branch, such as in bundle branch block, the duration of ventricular depolarization, or in other words the QRS duration, will be much longer. If the impulse is generated within the ventricles, as in this example, then it has to travel to the rest of the ventricle through tissue that's usually not well suited for conduction. So in this case, depolarization of the entire ventricle will also take longer than normal and the QRS complex will be broadened. This is an example of how such an impulse could look like in V1. So there are two types of broad complex tachycardias. In the first one, a pathologic focus somewhere in the atria has started to fire at a very fast rate, overdriving the sinus rate. progressing to the ventricles, but finding one of the bundle branches blocked. So we'll see a bundle branch block pattern. This is called atrial tachycardia with aberrant conduction. In the second, the pathologic pacemaker focus is situated somewhere in the ventricles and depolarizes the heart in the way just described. This type of tachycardia is called ventricular tachycardia. And how can you discriminate between those two different broad complex tachycardias? Well, first of all, if a broad complex tachycardia has P's in front of the QRS complexes, such as in this case, it's probably atrial tachycardia with aberrant conduction. If there's no P wave in front of the QRS complex, then the patient probably has ventricular tachycardia. Sometimes you might even find P waves independent of the QRS coming in at the slow rate of the undisturbed sinus impulse. But for this, you need a very sharp eye. We'll teach you a couple of tricks how you can do it in a later chapter. For you, it's important to know that atrial tachycardia with aberrant conduction is usually not a life-threatening condition. On the other hand, ventricular tachycardia can be life-threatening, and in most cases you have to take action immediately. So it's really important to check how the patient is doing clinically. Is the patient in cardiac arrest? Is he hemodynamically stable? How's the blood pressure doing? So I can't stress enough how important it is to be on the lookout when you have a patient who has a broad complex tachycardia. You have to check the patient clinically. If you're sure that the patient has atrial tachycardia with aberrant conduction, you can be sure that it's probably not a life-threatening condition. On the other hand, if the patient has ventricular tachycardia, then you have to be really cautious. These ventricular tachycardias often hit hearts already jeopardized by extensive disease or previous infarctions. Hence, the situation may become very unstable or life-threatening really quickly.
Apart from the facts that we've just covered, there are a couple of other clues that can also give you hints about the underlying etiology of a broad complex tachycardia, such as QRS morphology, for example. Certain QRS morphologies are typical of atrial tachycardia with aberration, while other morphologies are typical of ventricular tachycardias. More about these morphologies in the black belt section. But now it's time to practice. In the following exercises, you should determine the patient's heart rate, whether the rhythm is regular or irregular, whether the QRS is widened or narrow. If you think that you can already make a rhythm diagnosis, please go ahead and do so.